2. Good?
Can you go check with someone in the hallway and see if we're getting audio?
Okay. And I'm lowering from it. Cool.
Supposed to go? Should be on the YG.
Is it on there right now?
I don't know.
Good, man. How are you? Yeah. Oh, it's cold. It's nice out. Yeah.
Non, j'ai juste vu que tu m'as appelé, fait que j'étais appelé direct. Ouais. Ouais. What? 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 Parfait.
Oh, it's fixed now.
D'autres questions? Ok. Parfait. Ça fait plaisir à tous.
Very often there's this many people. Except for the weekend.
What's that?
I said it's not very often there's this many people.
You're gonna wear a
No, you'll need to find a bigger room if this is going.
Yeah. I'm pushing for just like a mobile setup in the foyer upstairs and see what that happens. Looks nicer than the dungeon here too.
Yes. Just looking at the people that are here and thinking, interesting.
By default, whatever. Yeah.
Yeah. Well,
Yeah, sorry. Did you mean to be rude? No, it's that is not normalized itself for me yet. It's like you just have to, you know, go back to the H1 hormone fist bumps, right? Yeah.
It's like, oh, I touch my face like 500 times in a day.
Yeah.
I see it.
Just gotta stop stroking your beard while thinking.
That's how I do my best thinking. Yeah, exactly.
My writing gets like immediately worse when I shave.
I just gave up on that shaving habit. It's too cold.
I shaved one winter and it was more so like the feeling of your jacket rubbing your face to death. It wasn't even the cold. You can fix the cold with a buff or something.
Yeah.
Ouais. Ouais, c'est ça, c'est difficile de savoir comment. C'est grave ou c'est pas grave? Ou c'est un peu grave? Moi, j'ai l'impression que c'est ça. Mais c'est clairement ça ici.
Stop and then give us a to restart it. Because now it's gonna have like 10 minutes or 10. That's okay. Yeah.
Moi, je
You can mute the mic right now. He's watching, Adam's watching the stream and you can hear people whispering. Okay, I got Marshall.
Everybody knows about our beards.
Everyone is in the building, walking to this room. Appreciate it.
I'm like muted right now. My wife is asking me to jump in front of the live feed to wave hi to her, and I told her
She didn't hear the beard comments, did she? I guess not. Well, that's good. I'm hoping that's the mic that's live up there. So.
use this?
Siri here. Let me know if I can help.
All right, thank you all for joining us here today for this briefing on COVID-19 and Yukon's preparedness for the situation. We have Health and Social Services Minister Pauline here, as well as the Chief Medical Officer of Health, Dr. Brendan Hanley, and the Deputy Chief Medical Officer of Health, Dr. Elliott. We also have our Director of Community Health and Programs, Kathy Scanner, as well as the Director of Community Nursing, Sheila Thompson, in case there's additional questions after our officials here speak. We're going to start with opening comments from Minister Frost, and then an opening statement as well from the Chief Medical Officer of Health, Dr. Hanley, and then we will go to Q&As.
Thank you. Good morning, and thank you all for joining us today. I believe that we have some officials here with us. Chief Kane's here, and Minister McPhee, so there are others here as well. Just want to thank you all for coming today, and thank you, media, for participating as well. With the threat of COVID-19 dominating headlines on a daily basis, there's a lot of coverage focused on how jurisdictions are preparing. I want to begin by stressing that Yukon is well prepared. Our top priority is the health and safety of all Yukoners. This week I reached out to the Council of Yukon First Nations, and I'm happy to say that the Chief Medical Officers, along with health officials, will be meeting with the Council of Yukon First Nations leadership tomorrow, along with their health directors, on the status of COVID-19 and our preparedness. Are you guys hearing okay? Are you getting feedback?
Feedback is not from me.
Okay, so let's try moving the mic.
It's not microphone. Somebody's camera is feeding back.
Okay, is that okay now? Okay, so let's just continue on. So the meeting tomorrow is really just to engage our Yukon communities. As we reach out into the communities, we want to ensure that everyone has the same information and that we are, in effect, responding to all the questions and concerns that are coming at us. This morning, I once again participated in a regular scheduled call with the Federal Minister of Health, the National Chief Medical Officer, and the Provincial and Territorial Health Ministers. So we do this on quite a regular basis to get updated on what's happening across the country. So I'm receiving regular updates from the Chief Medical Officer of Health. Both are here today, so thank you for being here with me on the status of this issue nationally as well as locally. If cases of COVID-19 appear here in the territory, we are ready, and planning has been underway for weeks to ensure we can manage any cases that arise. We have multiple systems in place to prepare for, detect, and respond to, and prevent the spread of the novel coronavirus. Our response is being managed by the Yukon Public Health Emergency Operations Center. Dr. Hanley, Chief Medical Officer of Health, and Dr. Elliott, Deputy Chief Medical Officer of Health, are leading this response. So I'm happy that they are joining me today to answer specific questions about the virus, testing, and health preparedness throughout the territory. The Department of Health and Social Services is working very closely with Yukon Communicable Diseases Center, Yukon Hospital Corporation, Yukon Emergency Medical Services, and the Emergency Measures Organizations on our emergency response and planning. We are also working very closely with our federal, provincial, territorial partners on the Canadian response to the COVID-19. Yukon is following guidelines established by the World Health Organization and the Public Health Agency of Canada. These guidelines have been adopted to the Yukon context. Clinical guidelines for health professionals in Yukon are being regularly updated and disseminated. Systems are in place to conduct surveillance and to identify, diagnosis, manage any cases in the Yukon, ensuring excellent care and the safety of healthcare workers and the public. The risk for COVID-19 still remains low here in the Yukon, and there are currently no cases in the Yukon. I know there are some concerns, of course, coming out in the media, and just want to assure members here that we have no detected case in the Yukon, but we are taking all the precautionary measures. I want to thank of course, Dr. Hanley and Dr. Elliott for being here, and just for the leadership and the guidance, because we certainly rely on them to guide us as health and social services into some unsettled times for Yukon, but we want to assure everyone that we are taking a coordinated approach, and we will continue really to work together and assure Yukoners that we're doing the best we can to get the information out. And we encourage everyone to, go to the websites, get the current information, reach out, and we will continue to do our best efforts as well. Thank you, and I'll now ask Dr. Hanley to take the mic.
Thank you. I'm back. I want to take just a few minutes to set the context, because I know that we want to have lots of time for questions. I would imagine there are going to be a few. I had a conversation, a fairly random conversation yesterday with someone who said, why all this fuss? Like, is this really such a big deal? And it's not that severe a disease. Why are we doing all this? And this is a big deal. And as the Director General of the World Health Organization said, we are in uncharted territory, and that uncharted territory is the same here as it is globally. And as you all know, it's changing as was said on the radio this morning, literally by the minute. So this is a question of adapting our preparatory measures as the change occurs, and that's why we are constantly in preparation mode. As Minister Frost said, we don't have cases in territory. We don't have confirmed cases. We will make an announcement if we do get a confirmed case. I'm sure at some point we will have a confirmed case. We have been doing lots of tests. We've been doing lots of investigations. There have been people admitted where there are questions about possibly coronavirus, and tests are being done. But and those are called persons under investigation. But we do not have confirmed cases, and I would be very surprised if today we did have a confirmed case. So I just wanted to try to put that part to rest. Now, what is special? So why is this a big deal? And of course, I know you're all here because you realize it's a big deal, but just to reiterate, this is somewhere between SARS and influenza. So it has characteristics of SARS, but it's less severe than SARS. But it's more transmissible and more contagious than SARS. If we compare it to influenza, it's more severe than influenza. Actually, potentially a lot more severe than influenza, but not quite as transmissible as influenza. So it's somewhere in between, and that's why it's different. I was around in 2009. I was here, not quite at this table, but at other tables during the H1N1 pandemic, and we managed our way through that. This has different characteristics, and there are significantly different features of the response, which I'll go over briefly. So one of the questions is around do we have a plan, or what's our plan, and that's what I wanted to focus on. But before that, and I guess it's wrapped up in the plan. Even though we are in uncharted territory, and even though this is something different, this is also completely manageable. It's actually, when you get onto the ground, it's actually not that scary. We know how to do this. We've done this in the communities with actually diseases like tuberculosis, which are more spreadable in terms of airborne transmission. This is not airborne transmission. This is spread like the influenza, large droplet contact type of spread. So this is something we well know. All our healthcare providers already well know how to manage, how to prepare for this. It's just the scale and the unpredictability of that which is presenting challenges in how we address this from a public health point of view. So do we have a plan? Do we have a pandemic plan? You know, I have to say, being sort of practical, I don't think in 2009 I ever really read the pandemic plan. I think what was, not that it's not important, but for the coronavirus, the public health measures are first and foremost the way that we respond. Surveillance is very important. That's why we're doing all kinds of testing. That's why we have a low threshold for testing. We're following the Public Health Agency of Canada's guidelines on testing. We're very closely aligned with BC and how they're approaching this, but we're looking for cases. That's the first thing. The next thing is containment. This is, as I said, eminently containable, at least in the initial arrival. So we're looking for that first case so it can be contained appropriately, and that we can then do the contact tracing that's required. And you know what? We're practicing this already. We're going through scenarios. We've had low-risk cases under investigation. So we're actually kind of doing this already, even though we don't have a confirmed case. The next case is, what if we get several cases? What if we get a cluster? So we're prepared for that next C. So first is containment. The next is, how do we manage clusters and continue to contain even if we have clusters of cases? And the next phase is community spread. So what if we get to a point, as in some other areas of the world, where we actually have it spreading? And then what are the levels of response? So at what point do we need surge capacity? At what point do we need to do things differently at the hospital to make sure we have enough room? When do we need to identify alternate facilities if we get lots of people at the same time? So it's planning for the appropriate response to the appropriate need. It's a measured response according to the need. So example, right now there are many questions about, should we have another event? We canceled our Winter Games. What about the Native Hockey Tournament? What about the trade show? What about all these other events? And so we're trying to answer those questions as best as we can with the premise that there is no community spread right now. We have no cases. We want to allow as much as possible to go on. And at the same time, when there are bigger events and riskier events, then we actually do a risk assessment so that we can provide tailored advice according to the scale and the circumstances and even the timing of the event. And what we advise today, we might be advising something different tomorrow. What we advise this week might be what we advise next week might be very different from what we advise this week. So that again is our adaptation to the global and the national situation. So I think that sort of covers hopefully the context, and I think we can let the questions begin.
I'm just going to step in and moderate. There's going to be a lot of questions. I want to make sure it stays orderly and that everyone can hear everything. So if everyone who has a question can put up their hands, we'll take them one at a time and get through them all. Start with David.
Yesterday's update, we're getting a lot of public response from yesterday's update. There was a line in it that said, if you don't have the symptoms, you can't give it to other people. People are sending us all these links and things. And even the Canadian Public Health Agency seems kind of, well, it would be rare, but maybe it could happen. What's your reaction to this? The public sort of saying, no, that's not true.
It's a great question. I'm going to start with that, and then Dr. Elliott might want to, since Dr. Elliott wrote the blog, and Dr. Elliott's been a fabulous technical support in terms of really digging into the literature, which is beyond what I usually do. So I think in that case we work well together. But the key point is, in theory, there may be that ability, and it's still kind of an unknown. Can you have actual transmission with asymptomatic contacts? The practicality is it's not contributing significantly, as far as we've seen so far, to the spread of the epidemic. So really the emphasis is, and that's very different from influenza, by the way. So influenza is characterized by the ability to transmit symptoms before to transmit infection before symptoms begin, and that is not a characteristic of coronavirus. It may have happened. It's not even certain whether it's happened at all in all of those hundreds of thousands of cases we've had. So, but what is pretty sure is that it is not contributing to the spread of the corona outbreak. Did you want to add anything to that?
I think that covers it, unless there's anybody who needs more detail.
It's between
we'll
us,
go with
maybe.
Tim. We've got-
Yep, Tim from CKRW. When did testing begin and how many have been done?
Why don't you take the motion?
Thank you, Tim. So for a person to be tested diagnostically, they need to meet the criteria. So we've had criteria out, it's changing at least twice a week. We've had it out for several months. We started having people meeting criteria only a few weeks ago, despite having criteria for quite a long time. The testing, at an earlier phase, we noticed that we were having a bad respiratory season. I think everybody across, certainly the other medical health officers across Canada, we've all been thinking, what if we get community transmission and we're not testing enough and we don't see it? So we actually did some preliminary surveillance testing in order to ensure that our increase in respiratory admissions, to, sorry, not admissions, but visits to the emergency department was not coronavirus, and it was not at that time. And since then, we started surveillance testing, which means that every person who's tested for flu is also in the background tested for coronavirus. And the reason for that is, again, we want to, if there is any cases that don't meet criteria or maybe don't come to hospital or look more like a flu, we want to catch those. We want to catch those early. Testing has increased, as you might imagine, in the past week. Concern in Yukon has increased tremendously. I think a lot of people were surprised by my recommendation to cancel the Arctic Winter Games. And the changes this week have really supported that was the appropriate thing to do. And alongside that, our testing criteria have expanded. So the numbers are changing so rapidly, I couldn't tell you, but it's at this point, scores of tests a day are happening.
How long are the tests taking? Are you having to send them to BC or?
So the testing is done in British Columbia because they have the expertise. There's only a number of labs across Canada. It started with 1, and then 3, and now it's expanding to university hospitals and major hospitals. The tests need to travel to Vancouver, to the British Columbia Centre for Disease Control, and then the results are reported electronically to us. It can take 3 to 5 days. Sometimes it comes a little quicker, but 3 to 5 days is a reasonable expectation. The 5 days is if there's a weekend in the middle of that. We get our tests to BC CDC as quickly as we can. The turnaround depends on a number of factors.
Julie?
Can you tell us when surveillance testing started? I didn't really get an answer there.
Mm-hmm.
And also, can you tell us how many tests there were, say, yesterday?
Surveillance testing started about 2 weeks ago. It was a bit of a soft start, to be honest. So it definitely started not this Monday, but a week ago Monday, as there was some testing sporadically before that. I have to get back to you on the number of tests that were yesterday, the day before, etc. It's just things are changing very rapidly at this point.
Something to work with would be great.
Mm-hmm.
Chris?
Well, just along those lines, like when you say scores, and I think we all concede that like you can't give us like an absolute right down to the figure number, but like what does scores mean?
It means more than 10, less than 100.
Okay.
Yeah.
Chris?
The Chief Medical Office in Nunavut said that if there is a case reported that they will notify the public of which community it's in. Is that the same for here in the Yukon?
We've decided in Yukon, because of the nature of our population, that we will not say whether a case is in Whitehorse or a community, even at that level. I want to reassure the public that we will know where that case is, we will know who their close contacts are, we will trace those people down and ensure that they get appropriate care and testing. But we also carefully guard the confidentiality of any person who's under investigation, and that includes not saying specifically where that test is from.
I might just add to that quickly. This is normal practice. This is how we treat all communicable diseases. So we see no reason to divert from normal practice.
So, I'm sorry. Can you explain like why that is? Because this happened with fentanyl too, I believe. Like, how does it violate someone's confidentiality if there's a case in Whitehorse or in Dawson City? How does it violate somebody's confidentiality to say that?
I can start, and perhaps Dr. Hanley can continue. I think anytime we have information about a person who's in the healthcare system, we are careful about sharing that information that's necessary to protect the health of the public. If the information is not necessary to protect the health of the public, then the information is not released publicly. It belongs to the person. If the person wants to announce publicly, they're absolutely welcome to do that. However, it's part of our protection of that information not to do that.
No, that's exactly.
We had a question from somebody watching. If somebody gets is diagnosed with the virus in a small community, will they stay there, or will they go back to there, or would they be kept maybe stored here in Whitehorse? I guess this is a matter of difference of opinion in the community. Some people don't want them to be there, and others maybe aren't.
So the management really would be, as we would manage other respiratory contagious infectious diseases. So the communities are, there are facilities and measures and people in place to manage this illness in the communities, just as there is here. But with the caveat that there's always a triage process and depending on severity of cases. So if, and the vast majority, as a reminder, the vast majority of identified coronavirus cases are mild cases and can be managed at home with appropriate public health follow-up. The public health follow-up can be done in the communities, the case management can be done in the communities. Now, if there's fear in the communities, that means that we have more work to do in being able to answer questions, to be able to be talking with communities. As Minister Frost says, we are setting up lots of conversations. I've had lots of conversations already, and we maybe need to keep doing that job of reassurance that when people are appropriately identified, appropriately isolated, then there is no threat to the community at large.
Gabrielle?
How many tests do we have, and where are we getting them from?
Did you hear it? How many
Hasn't that question been addressed?
Emissions of test kits at home as well.
How many test kits?
Oh, I see. Okay.
So the testing for coronavirus, the kit that we have here in Yukon is the same as for many other respiratory tract illnesses. So we have them, we have sufficient. What's unique is what they do at the laboratory. So having the appropriate reagents and being able to test in that way.
Is there
Oh, sorry, follow up.
Well, is there worry about not having enough? I feel like that was a problem in other jurisdictions, not in Canada, but in the States.
I think there's a lot of worry right now in general, and there's a lot of worry about not having enough of just about everything, from toilet paper to medicines to masks to test kits to whatever. I think it's normal when we have a new emerging virus, particularly when it changes so rapidly, information's coming out from many, many different sources, some of which are credible, some of which are not, that people are concerned. I think it's appropriate to be concerned. However, we have to channel that concern in the appropriate way. What that means is we need to look out for each other. We need to take care of each other. We need to use that concern to drive our ability to learn how to keep our germs to ourselves, how to wash our hands more regularly, how to do the elbow bump, how to cough into a tissue and dispose of that and then wash our hands, how to talk a little bit further away from each other. So that's the first point I want to make about concern. Your question was specifically about people are concerned about test kits. Nationally, we are working with the other provinces and territories. All of us are on national calls frequently. with regards to procurement and of equipment, of test kits and other pieces. Currently, we have sufficient, and for various things, there's different procurement mechanisms, but I guess what I want to say is that the provinces and territories are working together. There will be sufficient in the places where we need them, and at this point, I don't have any concerns about our ability to test the people we need to test. Okay.
Tim? People are looking at kind of what's going on in Italy right now, because they're kind of in the worst case scenario. I mean, they're literally like rationing ventilators. What is our ventilator situation here? How many ventilators do we have in the hospital? And can we, I know everybody's going to be wanting to grab a ventilator like other jurisdictions. Where can we get them from?
Yeah, I mean, I think when we look to areas that have rapid community transmission and the impacts that that can have upon society, economics, and people's lives, the healthcare system, it's quite challenging and grave to look at. The first place where that happened was in Wuhan City and Hubei province. In Hubei, in that province now, the number of cases every day is very low. The number of new cases in China yesterday was about 50 in the whole of China. Hubei was the first place in the world to have quite severe travel restrictions for entry into Canada. Those travel restrictions have now been extended to Iran. To be honest, right before I came, I didn't check the website, but they may be extended to Italy as well. In those places where there's that kind of community transmission, the measures that work are people keeping their distance and keeping germs to themselves, and those measures do work. And they work best when they're implemented before there's that widespread community transmission. The reason I'm saying that now is because I think people need to accept that in the future we may have measures here that we would never have expected in the past, and that we may have to adapt and take care of each other quite a bit, meaning that people might, when I had to recommend to cancel the Arctic Winter Games, I think a lot of people were really surprised, and some people felt that was an overreaction. I think now it's pretty clear why that recommendation was made. There may be other recommendations in the future that people will be surprised about, and I just ask the public to be patient. I don't have any plans for such recommendations. I'm not holding anything back, but when you look around the world, those measures have to be implemented early in order to work.
Like how many ventilators?
How many ventilators would be enough? What, you know, if I said we have 11, what does that sort of help? Or, I think the point is about, first and foremost, the public health measures are the main, as Dr. Elliott said. And the rest is contingency planning and surge capacity planning. I think we probably have 3, maybe 4, maybe 5 ventilators. But it's not the ventilators, it's the staffing that's required. And it's having the systems in place to manage according to the level. If we get into that kind of an Italian situation or a severe, like tons of cases happening at the same time, huge influx into a merge, then we scale up and we do the best we can, and we transport. When we have critical cases that exceed our ICU capacity at the moment, we transfer, and we have medical systems in place to do that. And the likelihood that we would be able to cope with that, with a high demand, is very good. But we may have to do all kinds of alterations in the hospital setup, and that's the planning that is occurring right now in how we manage. You know, do we have to? At that point, we would not be having elective admissions. We would be sending lower severity cases home. There may be points if you go up to the extreme, we might have to be making decisions on who gets the ventilator and who doesn't. What if everyone? So all of those levels of surge planning have to take place. But the likelihood is that with with the public, strong public health measures that might also have to be scaled up, as Dr. Elliott alludes to. That's how we're going to manage, and that's how we're going to save our ventilators for when they're really needed.
I think the other piece that's really important is that in addition to public health measures, everybody needs to take measures. So it's really important that now we all practice keeping our germs to ourselves. It's important that people think about, could I work from home if I needed to? Could I do some things virtually that I normally do in person? How could I have the same rich Yukon life that I have in a situation where maybe gathering in large groups is not a good idea? Maybe it's a time to go outside and enjoy times outside. So really thinking through, if I wanted to conduct my life and live in the extreme case, the Italy case, 2 meters away from everyone around me, what would be the various pieces of my life that I would change? And I think that's what we need to, each person needs to be thinking of. The other thing is that if anybody thinks that they might have been exposed to coronavirus, please make sure that you call 811. Make sure that you identify yourself. We want to help people have their diagnosis early and help their close contacts be also taken care of. So it really is going to take all of society, everybody, every individual, every group working together to ensure that we don't spread coronavirus around. We're doing our best, but it takes everybody as well.
I'm just going to keep going down my list. Julian, you're up next.
Just sort of falling in line with forecasted events that are in the works. Team Yukon has a celebration this weekend. There's announced this morning. Is that on your radar?
Absolutely, I was at the meeting yesterday. Yeah, and you know what? And I think it follows nicely from Dr. Elliott's. There was a fantastic conversation, and there was a fantastic. And yes, we're supporting that event going ahead. And again, it's in that context of we don't have community transmission. We're not bringing in people from all over the world for this. It's an event that's happening over the weekend. That's a kind of a celebration. The quote was about, Team Yukon. It's not just about the athletes, the coaches and the volunteers, although they're all such a fantastic team. We need to be Team Yukon right now, and that is like the entire community, because this is the public health response requires everyone working together, whether it's politicians, whether it's First Nation chiefs and leaders and governments, employers and employees, the business community. And I see that happening already, but that's what we need to really focus on, is that sticking together. And that doesn't mean to say, trust us and don't ask questions. I want the questions, I want the feedback, because that really helps us to know where the concerns are and to adapt accordingly.
Doug?
Doug Tremblay, Shone FM News. What is going to change when the first coronavirus case is confirmed in Yukon? What happens then?
We will let you know.
I was hoping you weren't gonna say that.
The sky will not fall down.
Okay, good. Okay. That's a good start.
Yeah. So again, I think this is something that not only that we know how to do, we've rehearsed. And our colleagues around the country have been doing. So the case will be identified. The conversations will take place with the case and any family, any household contacts. Public health measures will be immediately put in place. Testing as appropriate of contacts will occur if indicated. Quarantine, which is the 14-day isolation period of relevant contacts, and that is not the whole community. That is not, this is identified close contacts. So we've got and you can see all those guidelines. All our health professional information is publicly available. We do that for two reasons. One is to make sure that that the health provider, when they want the information at their fingertips, they can find it by basically Googling it. And the second thing is to make sure that we're transparent in what we do.
Thank you.
Can I just add on to what Dr. Hanley said? I think the other thing is that we've been ready for the first case for some time. I think what we're hoping is that the public doesn't overreact to the first case, to be perfectly honest. From a public health perspective, it's not a big deal. It's completely what we do with any case of infectious disease that has the same type of spread. So it's bread and butter public health. I think the concern is the fear, because it's normal for us all to be afraid a little bit of something that's new, it's emerging. We're seeing some challenging situations in other countries around the world. This is normal for people to be afraid. And again, it's what we do with that fear. It's the Team Yukon approach. Let's put that adrenaline into sticking together and staying together, and keeping our fear to ourselves, and using that to ask good questions and help each other.
The British government, I think, said this morning it's no longer possible to contain it there in Britain. Is it possible that the Yukon could go through the whole thing and keep it contained, or is that even possible?
If you're interested in that, I would suggest strongly that you read the WHO Joint China report, and you look at province by province what's going on in China. Because there are some provinces with very few cases. The only province with a high number of cases is Hubei province, and it is very patchy. And what Dr. Hanley was saying about the Cs, the first case, the first cluster, the first community transmission, those are the pieces that are happening around the world, and even within Canada, we can expect that there will be that same situation concurrently. First case in a few places was announced yesterday or today, or will be announced. First clusters are occurring. We currently don't have any widespread community transmission in Canada. In Yukon, the risk is low. We have no cases, and we want to keep it that way. If we do have a case, the risk will remain low, because we will do our utmost to ensure that cases and contacts are traced and isolated. The nice thing, in a way, about coronavirus is the concern, because people are really following public health guidance and being careful. And as long as we continue to do that, no problem.
So I have a question that I'll ask in English for the benefit of my colleagues, but I would like some time to have a couple of declarations or questions in French at the end, if possible, to keep time on. What are the challenges specific to Yukon going forward in trying to contain this?
Okay. Here's some of the things that we're thinking about in Yukon. Yukon is a small place. We have less than 40,000 people, or depending on the day, living here. We have one large center, Whitehorse, two smaller centers, and a lot of small communities. One of the challenges is ensuring that we, how do I say this best? That we don't import cases to places that don't have the best healthcare capacity, and that when the cases occur in those places, as they may do, that we ensure that the appropriate care occurs. So that's why we do all of the planning. You know, what if a case occurs in a smaller community? What are the steps we're going to take? How will we ensure that we've already when we distribute the healthcare guidance, we distribute it to every community health center, and it's available online, so it's available everywhere. We have a 24/7 on-call line for healthcare providers. So we think about these things, and then how do we adapt what we do for those reasons? So that's, for example, one of the things that we're thinking about in Yukon. I mean, every time we have a national conversation and decisions are made, Dr. Hanley and I and our team adapt those decisions appropriate to Yukon. Yeah.
So just to follow up, could we see closing the airport, closing the highway? Like, could we get to that?
You know, I think that would be very unlikely, because those measures, those sorts of almost like reflex closing of borders, to me speak more to a paranoia than, for the most part, than to a really rational public health based decision. Now, we will do our best to follow public health agency guidance, and that guidance might, you know, we follow the experts, we listen in on those conversations, we participate in those conversations. So my understanding, in general, measures like that may slow down influx, but will not stop influx. And at the same time, what are the impact? What are the consequences in terms of you know, how we keep our community thriving to the best of its ability? So it's always, you know, risk assessment. You know what? So for instance, what if we stopped visiting to long-term care facilities, like right now, as a precautionary measure? Well, what would be the consequences of that? So we have no community transmission, so we have no really good public health rationale to do that. And at the same time, we would be accentuating social isolation of our elders. So is that a rational move? You could say, well, that's a really kind of good precautionary move, but does it make sense for where we are right now? No, I don't think it does. So on the other hand, the Arctic Winter Games cancellation was a decision that was made on a precautionary basis, but because of a rapidly evolving situation. So I think it's just continuing to try to test and evaluate the science of these measures, and again, to make sure that our public health response is appropriately measured according to the threat.
Just to sum up what Dr. Hanley said, so it's some of the measures that have been taken around the world have resulted in restrictions in people's freedoms. Anytime we use that in public health, we recognize that that's challenging, a big ask, and that there's ethical considerations, and we weigh the harms and the benefits of those types of decisions. And so the response has to be measured and appropriate and warranted for the situation, and that's really important in our decision making.
You mentioned if you feel like you may have been exposed, you should call 811. Can you walk through the process for people, like what happens if you do that? Because presumably you don't want people just willy-nilly going to health centers and hospitals if they think they've been exposed. So like if you call 811, what happens?
So the question was, if you call 811 or if you think you might have been exposed, what are the appropriate measures to take? So same principles apply. Let's keep the germs where they are. Let's not spread them around. So the best scenario is you use the telephone to contact a healthcare provider if you think you may be experiencing symptoms of COVID-19. Somebody comes to you and tests you in your home or any place where you might be self-isolated, and ensures that you have the information that you need. That test, during that test turnaround time, you continue to self-isolate, and that test is returned. Public health will be in contact with you at the beginning of that period. They will call you with your test results. If it's negative, that is the end of your self-isolation period. If it's positive, they will call you again in a week or two, or depending on the situation. If somebody requires more attention, they will call them more regularly. And they will also be the people who ensure that you have the appropriate testing and completion of your disease, and that when you go back into society, that you are not communicating that disease to other. So same principles, keep the germs where they are, take care of the people, take care of each other, ensure the appropriate care. Yeah.
We've got time for a few more questions. I'm just going to go to Laura.
Ouais, une question en français pour Madame Elliott. Vous avez mentionné que la situation évolue rapidement, mais vous prévoyez maintenir ces mesures de surveillance pendant combien de temps?
Mais les mesures de surveillance qu'on utilise maintenant sont les mêmes mesures qu'on utilise pendant toutes les saisons d'influenza. C'est pas le même mot, la grippe, je crois.
Ouais.
Alors, c'est les visites à l'hôpital. On fait ça déjà et on va continuer à faire ça. Les surveillances laboratoires, on fait ça déjà pour la grippe et on va continuer ça. Ce qui est différent, c'est le diagnostic des personnes. Mais les systèmes sont les mêmes qu'on fait toujours.
A couple hours ago, that premier announced that he was urging all people who travel abroad that are coming to Quebec to self-isolate for 14 days. I personally know of 3 people who are overseas right now, and they're 2 of them coming back today, actually. Has that been considered? Are you telling people or thinking about saying, well, if you have traveled abroad, to self-isolate for 14 days as a precaution?
So at this point, people who travel abroad are asked to self-monitor. Self-monitor means you watch yourself for symptoms. At the earliest sign of a cough, a fever, a shortness of breath, you get yourself tested. We are not asking people who traveled abroad to self-isolate, except for in some specific circumstances. People who have been to Hubei province in China, people who have been to Iran, and people who have been to Italy. We ask those people to self-isolate when they don't have symptoms. Other than that, we ask people who traveled abroad to self-monitor and start to self-isolate if symptoms develop.
And I just want a clarification. You say there's no confirmed cases. Is there any suspected cases? There's the wording there, right?
Yeah, so what the wording means, if a person fits the testing criteria and is being tested, they're called a person under investigation, a PUI. And then we're waiting for the test result. Our test result is confirmatory immediately. So if the test is negative, they're no longer a PUI. They're like everybody else. If the test is positive, they become a case. So those are really the only terms that we have here in Yukon. If you're in a place where your laboratory cannot confirm the test, meaning it has a preliminary test, and then that test needs to be sent to the National Microbiology Lab, then you may have an interim period. But in Yukon, you're either, if you think you might have COVID and you fit the testing criteria, you become a PUI. If you're negative, you're regular, like everybody else. If you're positive, you become a case during that period.
Two nuances. One is we do not announce persons under investigation. So we're, as you said, we have been testing according to testing criteria and according to the guidelines that we've published for healthcare providers to follow. So there have been people who have, as you know, as we've said, that there are people being investigated. But we will only announce, and again, it's all because this is a normal process. It's protecting individuals. We will announce, but of course not identify confirmed cases. The second thing, just a brief follow-up on the travel, because there was a question. I had a question today, and it was about what about returning kids from spring break. So we will continue to follow the Public Health Agency of Canada, the Health Canada travel advisories. So currently that is, as Dr. Elliott said, so people who are coming from the so-called level 3 areas, which currently are Iran and Hubei province and Italy, those are the ones that are being asked to self-isolate. Others are being asked to self-monitor. So that would mean, yes, they are allowed to come back into school if they are not from those level 3 countries. So we are aligning ourselves with the Public Health Agency. Now, a week from now, that might be different advice, but that is the current advice.
We're gonna have to wrap it up there due to timing. If there are follow-up questions, I'm happy to collect them. We might be able to do a little bit of French commentary. I just